welcome back to Simply Fujica. Today I've got a great video for you today, and I know I spend a lot of time talking about home care. You guys have a lot of great questions, but I really want to speak to caring for people with the coronavirus. Guys, this is important. I just finished talking to someone on the phone, and we were talking about people still not really protecting themselves when providing care to people that have the coronavirus. And it's really important. Again, I don't think that it's anything malicious. Sometimes I feel like there just needs to be more conversation in how to provide care for someone. I want to make sure to get some knowledge out there just in terms of making sure that you keep intact a person's dignity while you're taking care of them, but absolutely still being safe. It needs to be in a safe manner. You can still protect yourself as you're providing that care. And so I thought it was really important and timely to have this discussion. A lot of this information is taken directly from the Center of Disease Control website. Guys, I will be sure to link that in the video, but I'll also be sure to include it at the bottom of within the video description. Guys, it has a lot of information that I'm not going to be touching here. For this video, I'm going to be highlighting the 3 areas in which you can really be safe and really take care of yourself as a frontline caretaker. Guys, I want to be quite honest. I'm not going to be sharing everything that I found on the Center for Disease Control. There's just a wealth of information there, but I want to speak to my caregivers specifically and really just highlight 3 areas in which you can really make sure that you're practicing safety for yourself. Okay, so again, for more information, make sure you reach out to the Center for Disease Control at their website to get more information and to keep yourself educated. It's very, very important. Before we go any further, guys, make sure if you haven't, make sure you hit that like button. Also, make sure to subscribe to my channel if you haven't already. And with that, let's get started. The first area that I'm going to talk about today is providing support. The best way as a caregiver that you could provide support is to make sure that you're helping that person with their basic needs. The number one way that you can do that is really help the person who's sick follow their doctor's order and take their medication as instructed. Now, because most of us work in non-medical home care agencies, you want to be careful here because you can't help actually distribute that medicine. So you can't give the medicine to the patient. However, you can give the client reminders as to when they should take their medication, and you can simply ask them, have they taken their medication for that day? There's ways around actually dispersing it, because we should not be dispersing it if you're in a non-medical home care agency or if you're working for a non-medical home care agency. However, you can provide a reminder for your patient to ensure that they're taking their medications as prescribed. For most people, symptoms last a few days, and most people start to feel better usually within a week. You can also inquire with your patient to see if the over-the-counter medicines are actually making them feel better as well. Make sure your patient that is sick is getting lots of rest, and make sure that they're taking in lots of fluids. As part of your arrangement with your client, you want to make sure that you're helping them with grocery shopping, running light errands for them. If at all possible and when possible, consider utilizing a delivery service. If possible, you want to limit the interaction you actually have with the client as much as possible. We're going to talk about how in the next 2 tips. The second item that I want to talk about, guys, is when you should wear a mask or glove. I want to make sure that I get this part of the video right, so I'm going to read this directly from the website. But you want to make sure you wear gloves when you touch or have contact with the sick person's blood, stool, body fluids such as saliva, mucus, vomit, and urine. You want to throw out your gloves into a lined trash can and wash hands right away. The caregiver should be asking a sick person to put on a mask before entering the room. The caregiver must also wear a mask when caring for a person who is sick. To prevent getting sick, Make sure you practice everyday preventative actions. That means you clean your hands often, avoid touching your eyes, nose, and mouth with unwashed hands, and frequently clean and disinfect surfaces. The last item that I'm going to talk about here is tracking your own health. Make sure you know the symptoms of the coronavirus. Those symptoms include fever, cough, shortness of breath. It's also important to know that other symptoms may present themselves as well. If you're having trouble breathing, that's a more serious sign and you may need to seek medical attention. Guys, that's it for this week's video. I hope you enjoyed the content. I wanted to put some education out there on how do you take care of yourself when caring for others. I also wanted to speak directly to the people who are taking care of our clients that are recovering from this illness at home. I want to give you a thank you. Thank you so much for your sacrifice and for your service. Again, guys, make sure you go to the cdc.gov for more information. They've got a wealth of information that you can really arm yourself with. Remember, knowledge is power. So if you haven't already, please make sure you like this video. Do not forget to subscribe to my channel. And most of all, take care of yourselves, take care of each other.